Digestive findings that do not require endoscopic surveillance, reducing the burden of care. European Society of Gastrointestinal Endoscopy, ESGE Position Statement. Introduction. Gastrointestinal, liver, and pancreatic disease demand a substantial use of healthcare system resources worldwide. It is estimated that in 2015, annual healthcare costs totaled $135.9 billion in the United States. In Europe, recent data suggests that there is a growing incidence of functional and malignant gastrointestinal disease across the continent, leading to an increased demand for outpatient visits, hospitalizations, diagnostic techniques, and invasive procedures. Awareness that early diagnosis of gastrointestinal (GI) cancer leads to a reduction in cause-specific mortality has led to massive utilization of endoscopic and imaging procedures, accounting for a significant share of gastrointestinal expenditure. As a result, a substantial proportion of patients who have been diagnosed with one or more precancerous conditions or lesions enter into surveillance protocols. This has been the case for patients with prior resection of colorectal adenomas or diagnosis of Barrett's esophagus, BE, or gastric precancerous conditions. However, cohort studies on the natural history of these conditions have shown that at least some of them do not have additional carcinogenic potential, thereby questioning the usefulness of endoscopic surveillance. To overcome a procedure overload on already limited endoscopic capacity, the general approach of European Society of Gastrointestinal Endoscopy, ESGE, guidelines, as well as those from other international or national societies, has been towards a much more conservative use of surveillance. This has been based on two main factors, namely the actual magnitude of the baseline risk and the efficacy of surveillance in reducing it. Moreover, advanced patient age, usually above 80 years, or less than 10 years of life expectancy and unfitness for further care, may weaken the clinical significance of endoscopic surveillance. This ESGE position statement aims to provide an updated summary of recommendations with regard to endoscopic findings that do not warrant endoscopic surveillance based on guidelines by ESGE and other gastroenterological scientific societies. Adherence to these recommendations would reduce costs and morbidity and optimize the use of human and material resources. Methods. A list of prevalent gastrointestinal conditions that may not require surveillance was elaborated with reported prevalence and malignancy risk. In July 2019, clinical guidelines and position statements published since July 2009 by the leading European and American scientific societies were screened for non-surveillance statements addressing these conditions. When more than one guideline from the same society was available, the most up-to-date version was selected. A literature review restricted to peer-reviewed journals was also conducted in PubMed, Web of Knowledge, and Embase in search of relevant articles that might have a significant impact on the recommendations. Articles published in English were considered. Statements. With the aim of reducing the overall burden of care, ESGE recommends against surveillance of a series of conditions, namely, ESGE recommends against surveillance of individuals with the following: an inlet esophageal patch, Los Angeles, LA, grade A or B erosive esophagitis, or less than 1 centimeter columnar-lined esophagus. ESGE recommends against surveillance of those with intestinal metaplasia limited to the antrum unless additional risk factors are present, such as persistent Helicobacter pylori infection, incomplete metaplasia, or a family history of gastric cancer, or for fundic gland polyps in the absence of suspicious endoscopic features or hereditary syndromes. ESGE recommends against surveillance of gastrointestinal leiomyomas, lipomas, and antral pancreatic rests, provided that these lesions have typical ultrasonographic features. ESG recommends against routine endoscopic surveillance in duodenal peptic ulcer unless symptoms persist despite adequate therapy. ESGE suggests against surveillance of confirmed pancreatic serous cystic neoplasms. ESGE recommends against endoscopic surveillance for patients with hyperplastic polyps in the rectosigmoid, with 1 to 4 adenomas 10 mm or less with low-grade dysplasia, or with a serrated polyp less than 10 mm without dysplasia. ESGE recommends against surveillance of gastrointestinal conditions in individuals over 80 years old who have less than 10 years of life expectancy and poor general health status.